I've got a short presentation for you to give you a flavour of what we have to offer here at Bristol Dental School. And at the end, there'll be plenty of time for questions. So I'll look forward to chatting to you more after the presentation. So here at Bristol Dental School, the skills and interests of our community are incredibly broad. We are one of the largest studies of head and neck cancer in the world and research into using virtual reality for improving healthcare. We pride ourselves on being at the forefront of the dental profession. This world-class interdisciplinary research feeds directly into our teaching and makes us one of the top UK dental schools, as well as a leading research institute. We are a tight-knit community of clinicians, academics, students and teachers working and learning together. We offer two main courses, dentistry and dental hygiene and therapy. Learning is integrated between the clinical and non-clinical disciplines and between professional groups. And we also have a dedicated teaching team to support our dental care professionals, the hygienists and therapists. So why would you want to choose dentistry or hygiene and therapy for that matter? Dentists, hygienists and therapists can have a transformative impact on people's quality of life. From removing pain to restoring their self-confidence, it's the perfect choice for anyone seeking a highly rewarding career. And you'll start seeing patients early on in your studies, so you'll be making a real difference to people's lives as an undergraduate. 90% of our graduates go on to work and or study within 15 months of graduation from the course and find their current work meaningful. A degree in dentistry opens the door to a variety of career opportunities within the profession and beyond. So I'm going to focus very much on BDS dentistry rather than the hygiene and therapy course, because I believe that's what you're most interested in. So BDS stands for Bachelor of Dental Surgery, and that is the degree you graduate with on successful completion of our programme. So what makes studying dentistry at Bristol special? In 2019, we launched our brand new BDS 21 curriculum, designed with input from our current students to train dental professionals equipped to practice in the 21st century. One of its main aims is to integrate theory with clinical application, and it's already receiving great feedback from our current students. They are enjoying the clinical activities and being able to put their knowledge into practice as early as possible in their degree. Our courses are accredited by the General Dental Council, which is our professional governing body, and supported by excellent clinical and research facilities in the heart of the city of Bristol. Our new curriculum puts clinical activity at the heart of your learning. Throughout the course, you'll be able to put theory into practice, first in the clinical skills laboratory, and then with real patients as you develop as a practitioner. The school is also renowned for its multidisciplinary research that underpins all of our teaching. For example, our biomaterials experts use 3D printing to control the structure and properties of ceramics to design more cost-effective materials for restoring teeth. Their research actively informs our clinical practice and therefore our teaching. Our school also has a dedicated series of student support schemes in place alongside the Central University student support facilities, and I'll cover that in a little bit more detail later. So let's have a look at our curriculum. This diagram summarises how our curriculum develops through the 5 years of the programme. The curriculum's built around 4 major themes, which you can see detailed in the middle: practitioner, person and citizen, scholar and scientist, and professional and agent of change. These themes develop in breadth and complexity throughout the 5-year programme, allowing you to develop as a healthcare professional, a scientist, a clinician, and as a person who is committed to self-care, team working, and lifelong learning as required by the General Dental Council. We're going to look in a bit more detail now and drill down into those major themes. Here you can see some of the detail of the learning that goes on with each of those 4 major themes. And from that, I hope you can begin to understand that the breadth of study in dentistry is huge, including such topics as the biosciences, anatomy, physiology, and biochemistry, pharmacology, human disease, ethics, and very importantly, clinical communication. Our clinical communication teaching in the school is excellent, and we use actors to help you develop your skills to be able to build a rapport with patients, which is of paramount importance. We have to gain the trust of our patients before we can treat them. And of course, you will learn all the technical and surgical skills to practice a range of procedures to care for patients and their dental health. I thought it would be useful for you to have some idea of the key activities in year 1. So there's year 1 laid out into the blocks of teaching. All university students start with Welcome Week. There are central university activities, but within the school, we've got some in-house activities to help you feel part of the dental team from the first week with us. Your first block of teaching is called Foundations of Dentistry, and in that, you'll start to build the knowledge you'll need to progress to clinics in the second term. So you'll be learning about anatomy and biochemistry and physiology, but also some clinically related topics like how to take a history from a patient, starting with your clinical communication training sessions. Very exciting and new for the new curriculum is the conference that takes place towards the end of the first term, where you will have the opportunity to participate in your first professional or dental conference. You'll also have the opportunity to build your confidence through presentation skills and working in teams to produce work to present at the conference. So that's been really well received. Students and staff all really enjoy that at the dental conference in year 1. And then you'll move forwards to clinical activities. In year 1, these are peer-related activities. So you'll be working with your peers within your year to develop some basic skills that you will need before you progress to patients, and we'll look at those in more detail on the next slide. And then the end of the year finishes with assessments, exams, and resits if required. So here's a look at the clinical activity you can look forward to in year 1 with us. It's a 13-week programme. I've just shown you the first half. All of these activities on the left-hand side, you'll be putting into practice in small groups on clinic. So you'll come onto our clinic, you'll have already been given your clinical scrubs, so you will be taught how to dress appropriately for clinic with personal protective equipment, have a tour of the clinic, and then you'll start to put some communication skills into practice. So on the left-hand side, we've got the activities that you will take part in your small peer groups. And on the right-hand side of the table, you can see sort of the integrated background learning that you will be receiving via lectures, tutorials, possibly small group teaching, self-study, which will complement and give you the information you require to get the most out of the clinical activity sessions. So I mentioned our support schemes. Within the school, we've got dedicated support for our dental students to make sure every individual is nurtured to achieve their best. So our students at the heart of everything we do here in Bristol. For example, when it came to designing our new curriculum, we worked closely with our current students so that we could design a curriculum that would allow them and future students to succeed. We value the thoughts, experiences, and contributions of our students. Our committees include student representatives from each of our courses so that the student voice feeds directly into our decision-making every step of the way. Each new student will have a personal tutor to support them throughout their studies, and their senior tutors are on hand as a second point of contact. If you have a subject-specific query or concern, you can turn to one of our advisory mentors who can give you the support and guidance you need to succeed. You'll also be paired with a student in one of the higher years so that you have someone beside you that uniquely understands what you might be going through, having been there so recently themselves. Lastly, we have a team of students and staff that have volunteered as equality, diversity and inclusion champions. These champions are active advocates for equality issues and inclusion in the school, so are a great contact if there's something you'd like to see changed or challenged in our community, or if there's something you'd like support with that you haven't been able to find elsewhere. Our University of Bristol Dental Student Society brings students together with social events, sports teams, and welfare representatives. Each year, they have been extremely successful supporting a given charity. So lots of the fun events they organise also raise money for a good cause. There will be lots of opportunities for you to get involved if you choose Bristol. Here, you can see students off enjoying themselves outside of the school. As a school, we run lots of events and socials and activities to bring our community together. At the end of last term, as is a bit of a tradition, our students organised the final year dinner on the SS Great Britain, which you can see up in the photograph on the top left, which is a marvellous ship in dry dock in the harbour. And we all went there to celebrate their success as final year students graduating from our course. I'll finish off by giving you a quick overview of our admissions process. Detailed information is best found in our admissions statement on the university website, but I'll just give you a brief overview of how we run our admissions process in the school. So, applicants are selected initially on their academic performance, be that A-levels, as I've got here, 3 A's in chemistry, another science, and a third subject of your choice. We also obviously accept a wide variety of other qualifications, including the International Baccalaureate, and the details on that are we require 36 points overall, with 18 at the higher level. And 6 have to be at high level in chemistry and 1 of biology, physics or maths, which kind of mirrors our A-level requirements. If you have the required grades in the necessary subjects, then you are eligible for selection for our interviews, and we select for interview based on the university's clinical aptitude test, the UCAT. This year, we're piloting a scheme where we just use the UCAT score to select our students. And this year, again, because of concerns about COVID and travel across the world, and to make our interviews fair for any applicant, we are going to be holding remote structured interviews again, as we did last year, and offers are given out based on interview scores. The interview will probably, again, as it did last year, consist of 4 conversations with 2 members of staff. Last year, we asked applicants to prepare something before the interview to discuss at the interview. The purpose of the interview is to get to know you as an individual. For example, we like to know what you like to do in your spare time. We are also looking for a realistic insight into what it means to be a member of the dental profession and reflection on work and other relevant experiences. And of course, for a face-to-face healthcare profession, we are looking for outstanding communication skills. In our current building, we can accommodate 80 dental students. Our number of dental students overall could increase when we move to our fantastic brand new dental school, which is in the planning stages and hopefully will be finished towards the end of 2022. And we're all very excited about that. It's going to be a fantastic facility. The numbers of graduating dentists in the UK is carefully controlled to meet public health demands, and our numbers of home and overseas students are usually regulated to 67 home students and 4 overseas students. And we call these our capped places because they are controlled. If you've been doing a quick bit of maths there while I've been talking, you will see that we've got room for a few extra students. And we can offer a few uncapped places to our overseas applicants. The fees for uncapped places are higher than the capped places because students would need to pay for their clinical placement, as this is not funded by the UK government. Uncapped place offer holders also waive the right to practice in the UK after graduation and are unable to join the NHS Dental Foundation Training Scheme. I hope you've enjoyed our quick tour of dentistry here in Bristol, and I now welcome any questions that you may have.